Hartford HealthCare is expanding care beyond the doctor's office through a new partnership with Cadence. The program uses AI-supported monitoring and clinical support to help seniors with chronic conditions stay healthier at home and receive care in between visits. Joining us today is Jawad Haider, interventional cardiologist and medical director of value-based care at the Hartford HealthCare Medical Group. Welcome, doctor. Thanks for being here today.
Thank you for having me here today. Really appreciate it.
We appreciate you. So what can you tell us about this new partnership with Cadence? What is Cadence for those who don't know?
So Cadence is a company which Hartford HealthCare has partnered with and launched what we call Hartford HHC Remote Care. And what it enables us to do is provide chronic care for patients with certain chronic medical conditions such as high blood pressure, diabetes, or congestive heart failure, when patients are not in our offices, by staying connected with them.
Very intriguing, doctor. Can you walk us through how it all works? How is this company, this technology, able to identify health concerns before they get more serious?
So the first thing is enrollment, right? This is a voluntary program. We ask when a clinician has identified a patient who is eligible for this. The patient is enrolled with their consent, and after that, we send them some connected devices, cellular connected devices. For these patients, it could be a weighing scale, a blood pressure monitoring apparatus, or a glucometer. Once they get that, they start taking their daily readings. We can look at these readings in real time because these devices are all connected. And then if we feel something that is out of range, we can act on that proactively. So this is how proactive care usually works, and that's the way we can prevent a lot of progression of disease from happening.
Wow, it seems like this is going to be incredibly helpful for these patients. And speaking of the patients, tell us who is the best candidate for using this program. I know you mentioned earlier in this interview, people who live with heart failure, diabetes, high blood pressure. Who should be using Cadence, in your opinion?
So Cadence, or HHC Remote Care, as we like to call it now, these are the three main conditions that we are looking at. And the important thing about looking at these conditions in patients with high blood pressure or diabetes tend to worsen over time. The more we can control these diseases and try to get patients to be in normal ranges, or try to get them the exact treatment when they need, we prevent a lot of disability. And that disability can cause a lot of harm to the patient. For example, we can prevent hospital admissions, readmissions, making sure that these diseases are not progressing to advanced stages such as heart failure. When we do that, we are able to better take care of these patients where they are closer to their home.
Very encouraging news. Congratulations on this new partnership, and we wish you all the best. Thanks for coming on the show, doctor.
Of course. Thank you so much for having me.